So where were we? The molecular dispersion where particles are invisible in electron microscope, but in case of colloidal dispersion, the particles are resolved by electron microscope, but not in optical microscope. But in case of coarse dispersion, the particles are visible under the ordinary optical microscope. For molecular dispersion, this dispersion system pass through the semi-permeable membranes and as well as filter paper. But in case of colloidal dispersion, it passed through a filter paper but not pass through a semi-permeable membrane. And for coarse dispersion like suspensions, they do not pass through the filter paper, pass through either any filter paper or any semi-permeable membrane. Before entering this slide, the types of colloidal system, we have to know some important things that pharmaceutical applications of colloids are as follows. Like therapy, some colloidal dispersion show better therapeutic action and that are used in treatment. Like few examples are silver, silver salts, copper salts, mercury salts. Silver germicidal, copper anti-cancer, and mercury is used for anti-syphilis. Newly developed polypeptide chemotherapeutic agents are delivered in form of colloidal dispersion by convenient route of administration, uh, like orally and parenterally. So therapeutically applications are there for colloidal system or colloidal dispersion system. Next is absorption and toxicity. Colloidal sulfur shows better and faster absorption compared to a coarse dispersion of sulfur. Complete absorption of sulfur from a colloidal dispersion results in high concentration in blood, which often leads to toxicity. So absorption is better for colloidal dispersion system compared to coarse dispersion system. Next is solubility. Solubility of drugs is very much important and is improved by using the colloidal system containing the surface active agents. For example, solubilization of sulfonamides and phenobarbital that are made in a micellar solution, associations of colloids. Next is stability. Dispersions of surface active agents, which is association of colloids that are used to improve the stability of drugs in liquid dosage forms. Colloidal dispersion of macromolecular like gelatin and synthetic polymers like hydroxypropyl methylcellulose or HPMC that are applied as a coating solution on tablets and granules. Upon drying, a thin uniform film is left on solids, which protects the medicaments from adverse environmental effects. Thus, colloidal systems are used as a pharmaceutical excipients vehicles, carriers, and products components. Next is the targeting of drugs to specific organs. In the development of drug delivery systems, colloids are used in targeting the drugs to the specific body organs. For example, drug-entrapped liposomes are drugs entrapped liposomes are being preferentially take up by liver and spleen. Other colloidal drug delivery systems includes the carrier systems such as liposome, neosomes, nanoparticles, and microemulsions. Colloidal systems are official and meant for parenteral use that are iron dextran injection (BP). It contains the dextran complexes with ferric ions. Intramuscular injection is used in the treatment of anemia. It is an example of non-ionic hydrophilic sol. Next, iron sorbitol injection (BP). It consists of sorbitol, dextran, and citric acid complexes with ferric ions. It is meant for intramuscular use. So there are some pharmaceutical applications I have covered. Next, some important things are there. Uh, that is characteristics of dispersed phase in colloidal system. First one is particle size. Particle size influences the color of dispersion. The wavelength of light absorbed by particles is approximately related to its radius. The larger the particle, the shorter the wavelength of light transmitted. I have told here. Okay. Red gold salts takes a blue color when the particles increase in size. Next is a particle shape. The shapes of particles in dispersion depend on the method of preparation and affinity of the particles to the dispersion medium. Shape also influences the color of dispersion. It is believed that spherical particles of gold is indicated by red color, while the disc-like particles of gold gives a blue color. Shape of some of colloidal particles are also very much important parameter of characteristics of dispersed phase. Next characteristics of dispersed phase is surface area. As the size of colloidal particles is of the order of few micrometers, these particles possess enormous surface area. When compared to coarser particles, the larger the surface area makes them effective catalysts. Example is platinum colloids. The larger surface area enhances the solubility of drug particles. Okay, next is surface charge. Colloidal particles possess charges on their surfaces. The charge on these particles and its environment in dispersion medium like negative and positive. For negative, acacia, sulfur, tarraconite, and for positive, gelatin, bismuth, and aluminium. As the size of the particles is small, an appreciable fraction of their atoms, ions, and molecules are located on the surface, the particle air, or the interface, the particle liquid. Okay, the interior of these particles are electronically neutral, but the surface become charged. The reason for the origin of charge on the particle surface are as follows. Like functional groups present on the surface may get ionized. The ions present in the medium may get absorbed onto the surface of particles. Okay.